A coronary angioplasty procedure is also known as percutaneous coronary intervention. The procedure is done on blood vessels called coronary arteries. They supply your heart muscle with oxygen. The goal is to restore blood flow if a substance called plaque has significantly narrowed these vessels. To begin the procedure, the doctor will numb the skin in your wrist. A needle will be placed through your skin and into your radial artery. Next, a flexible guide wire will be passed through the needle into your artery. Then, the needle will be withdrawn. It will be exchanged for a small, flexible tube called a sheath. This permits access into your artery. You may feel pressure when the doctor inserts the sheath, but you will not feel it moving inside your artery. Next, the guide wire will be advanced up to your heart. A flexible tube, called a catheter, will be advanced over the wire to your coronary arteries. The progress of the procedure will be checked with an X-ray device called a fluoroscope. At this point, your doctor will remove the guide wire. Then, the doctor will move the tip of the catheter just inside the coronary artery to be examined. A special dye will be injected into the artery. This allows your doctor to view it better with the fluoroscope. The dye will make any blockages in the artery stand out. If a significant blockage is found, your doctor will insert a guide wire into the artery. A balloon on the tip of the catheter will be moved along the wire to the blockage. When the balloon inflates, it will expand the artery and improve the blood flow. You may feel some chest discomfort while this is happening. After this, your doctor will deflate and remove the balloon. A wire mesh tube, called a stent, may be placed in the treated area. The stent helps keep the coronary artery open. Your doctor will choose the proper size stent, which is compressed over a balloon. The stent will be moved into the artery over the same guide wire. When the balloon is inflated, the stent will expand and lock into place. After the balloon catheter is taken out, the stent will stay in place to hold the artery open. At the end,
The therapy of atherosclerosis in the cardiovascular system can be extremely challenging. Especially complex peripheral lesions require demanding treatment strategies. Stenting, in particular in the proximity of the knee, is most challenging due to biomechanical forces acting on the stent. The multiple stent delivery system, VascuFlex Multilock, is made to handle these challenges. With 6 short stents mounted on one delivery system, VascuFlex Multilock enables spot stenting only where it is really needed. Each self-expanding nitinol stent has a high radial force. The 13mm long stents have a closed cell design with tantalum markers on the proximal ends of the stents. The tantalum markers also help to prevent stent jumping. In this example, 4 highly calcified lesions are in a 13cm long segment. After pre-dilatation with a balloon catheter, the first short stent can be implanted. By turning the wheel on the handle, the stent is released into the lesion of the vessel. The stent is completely released once the marker band is unlocked from the mount point. Each stent can be implanted only where its scaffolding properties are needed. A distance of at least 5 mm between neighbouring stents is recommended. Already implanted stents can be passed to release additional stents distal of the previously treated lesion. All implanted stents should be post-dilated for better stent vessel conformity. In case less than 6 lesions are treated, unused stents may remain in the delivery system. VascuFlex Multilock leads to less acute and chronic trauma due to less material in the vessel wall. It helps to maintain natural vessel movement, whereas stent fractures can be avoided.